Great forum, great learning. Thank you for sharing. So when you talk about some of the innovative ideas that we are pursuing, I think putting insurance and innovation in the same word sometimes may not be very believable, given that insurance doesn't typically make it to the dinner table conversation. But I will tell you what the key insights we have learned are. So like you mentioned, maybe I'll start with what we have done in the continent, across the Uganda and Kenya, but important to know that today I'm only representing Kenya as a CEO for the Kenyan business. So as you mentioned, Joanne, we undertook a preliminary business case in Uganda to look into a possible blended model to address a healthcare model for the base of the pyramid. And whereas we did not eventually end up going to the market, we learned a lot from that exercise. Our key learning points were around the need for partnerships across the entire health value chain. So that's with the health providers, government, insurance product manufacturing and distribution, pharmaceuticals and diagnostics, etc. Because if we were then able to get partnerships in play that allowed us to bring down the cost of cancer and healthcare provision, then it was definitely going to impact insurance premiums in exactly the same way. And that speaks to the biggest challenge we had as to that particular customer segment, which is matching affordable premium to relevant cover limits. And so the question then, and the opportunity we think that still needs to be explored, is the opportunity for a blended finance model that addresses matching affordable premium to appropriate care limits and partnerships that then allow for the lowering of costs. Now, in Kenya, we launched a product, what we call a critical care product. And so we launched it for the middle income market with a maximum cover benefit of about $115,000, which is paid upon first diagnosis of a critical illness, cancer included. I want to take a pause there and just give you context of how our market is structured. So the way our market is structured is you've got, from a critical illness and specifically cancer perspective, you've got majority of the funding coming from out-of-pocket costs. And that is then followed by the National Hospital Insurance Fund, which is government funded, which we pay premiums for as individuals. And then you've got private healthcare. Now, within private healthcare, there's then the health insurance providers, and this is regulatory. There's the health insurance providers, and then there's the life providers. Prudential Kenya is a life insurance provider. So at a product perspective, the kind of product we provide is a health sort of life benefit payment upon the occurrence of risk. So this means that we will pay you only once the risk is diagnosed. But then you then take out the cash amount, and then as a patient, you can decide which health protocol to follow. Now, once we launched our critical care product, we had feedback from customers who said, we want it for our relatives up country and for our brothers and sisters who can't afford such high limits of cover. So we went down to premiums as low as $9 per month, and we are registering some positive growth on that. The other things we've done is in the middle income segment is we facilitated free cancer checks to our clients in partnership with a hospital chain and one of our bank assurance providers. More recently, based on the insights that we've generated from ESG perspective, we are actually just about to embark on a partnership together with the Ministry of Health and a few other partners to run a program where we are physically training health workers on how to manage cancer patients, how to demystify early screening and detection, how to shorten the period between diagnosis and treatment, etc. And so we think that as a responsible insurer, we've got to be able to affect the entire value chain. But as a private insurer, based on the experiments that we have run, our insight is that to be able to cater for the lower end of the economic pyramid, it is very difficult to do that without some sort of subsidization. given the experiment that we tried to run with them. Thanks, John.